Our next speaker is Dammy Ogunseitan, who will be speaking to us from Surviving to Thriving, Overcoming the Challenges of Sickle Cell Disease. Welcome.
Good morning. My name is Dammy Ogunseitan. I'm just here to give a quick presentation about what it takes to live as a sickle cell patient. Just want to say a big thank you for inviting the patient here. You guys already heard from one of my doctors, so I'll keep this brief. When I was putting these slides together, my son was like, more pictures. So I only put pictures in it, and then I'll be able to tell a story. So I'm Dammy Ogunseitan. I'm Senior Director at a strategic marketing firm called Kirk & Co. I am 41, so might not look it, but I am 41. And yeah, this is a little bit of my story. I was born August 14th in Lagos, Nigeria. And I was diagnosed with sickle cell at 6 months. So I've asked my mom what it was like back then, because I'm sure most of us can't remember how, when we were 6 months. But she said the first thing she noticed was at around 3 months, I wasn't sleeping. My limbs were really swollen. They didn't know what's going on. Then they took me to the hospital. And she got the news that I was sickle cell. And I'm an only child. I think it was kind of hard for her to have a kid. So the one she got had sickle cell. So it was, it's been her life's work to make sure that I survived. I think when they took me to the hospital, especially in Nigeria back in the 80s, not that much to do with nothing they could really do with a kid that had sickle cell. They just said, you know what, you just need to go home and figure this out. So I think growing up in Nigeria, they kept telling her, like, listen, this kid's not going to live to see 18, so do what you can. So I was kind of like a sheltered kid, but I was always ill. I was able to grab some pictures of me when I was back in Nigeria. That's my mom in the right-hand corner. I think that's the earliest picture of me. So, like, life in Nigeria was tough. I remember just a lot of pain crises. I think I was sick every month, like Dr. Vinesh said. And it was just basically treated it at home. And how do you treat sickle cell at home? Drink water. So basically the only thing we had to use to treat my pain crises was basically water. So I'd have to go 3 to 4 weeks with severe bone pain just using water. So what are basically the challenges of sickle cell? The cool thing is my mom was in a position to do a lot of research as to, how do I make sure that this kid survives, right? He's the only kid I have. Let's figure it out. At some point in the 90s, she moved here to Canada. I was still back in Nigeria. I did my high school back in Nigeria. But she met a doctor called Dr. Vickers, the late Dr. Vickers. And after she met Dr. Vickers, a hematologist here at St. Paul's, she was determined to bring me here to Canada. So in 2002, I got here to Canada, and I think the next day I saw Dr. Vickers. And she was like the first doctor to basically say, and I will never forget these words, it's like, let's think about your quality of life. Let's switch the mentality of, living to die, right? And actually start living. So as a kid, I started to think, okay, what kind of jobs can I have? I can't do jobs that, like not to work outside. I just had to start thinking about how to live my life here in Canada in a way where I would survive. So at that point, I started looking at courses, at making sure that I would have a job that'd be in an office. Those kind of thoughts are, what we sickle cell patients have to start thinking about, right? If you do want to live, you not only have to, have a community around you, but also have people who, can basically tell you, what you need to do to basically see the next day. So at that point, I started to look at just do things by myself. They introduced hydroxyurea, as Dr. Vinesh said, and I've been using it for over 20-something years, and it's worked for me. I know a few of my doctors and my nurses here are always on me to making sure I use it. But when you grow up as a kid and they keep telling you use this every day, it's a little bit harder. It can become just tiring. So sometimes I go maybe 2 weeks without using hydroxyurea, and what happens is I end up in the hospital. And so it's one thing I do want to impact on you guys is there are a lot of kids out there that do need a community of doctors, a community of people who can basically help them survive this disease. And I'm grateful that I found that at St. Paul's. But yeah, so something that also happened, and I'm jumping around because I'm telling the story, you can tell I'm nervous, is having my kid. I never thought I'd be in a position to have a kid. And just to be able to do that, I had to work with my doctors, Dr. Merkley. At that point, I had to stop using hydroxyurea for about 6 months just to be able to have Brixton. So those kind of complications for sickle cell patients are things that I would have never thought about. And during that period as well, right, what can we do to make sure that Dammy doesn't end up in the hospital just because he wants to have a kid? I'm blessed that I was able to find doctors who were able to work with me to be able to have a kid. And now I can say that I'm 42 years old and I have a son. Never knew that that would be something that would ever happen, but I am grateful to basically the doctors that I work with to be able to do that. So I've gone from someone who was basically treating sickle cell with water to someone who now has a community of doctors and nurses that work with me every month to be able to survive. Not only that, I do have people who understand the illness at work as well. I used to have a job where they never believed that I was sick every month, and that basically, had complications with that job. But being able to have people around me at work, at home, and at the hospital has been very beneficial to my survival. Dr. Vinesh brought up a point that I do want to basically impact on you folks. It's really hard for patients, especially when that crisis starts, for us to come to the hospital to seek help. There were a lot of times where I showed up at the hospital and they thought I was drug seeking. Being in that sort of pain and having to explain to people who have never heard about sickle cell is usually challenging. So I'm happy that I've been able to work with my set of doctors to be able to overcome that. The issue with that is I don't go to any other hospital. I only go to St. Paul's. I live in Langley, and when the pain comes, I drive an hour and a half to go to St. Paul's because I don't have it in me to go to another hospital to restart the story to individuals who don't understand what my plan is to get the treatment. I did that 2 months ago, and it was probably the worst decision I've ever made in my life. I ended up at a hospital where they did not understand how to treat sickle cell. What happened was my stay at the hospital became not pleasant. It was one of the worst decisions in my life because having to explain to doctors to try and call St. Paul's just didn't go anywhere. I had to discharge myself, put myself in a cab to come down to St. Paul. And when I got down to St. Paul's, the doctor was like, "Why did you do that?" And it's like, I should have known better. But that's where we are. I know sickle cell is a disease that not a lot of us have, but it's also a disease that I've seen more young kids have because we've kind of stopped talking about it. I think there was more conversation about sickle cell in the 90s where there was a little dip, but now we have more kids that have sickle cell. Anyways, that is my little presentation. I just want to say that there are people out here that deal with this disease and can survive it given the right people around them. So thank you. That's it.
Thank you very much for sharing your story. Do we have any questions from the audience?
Dammy, you're an inspiration.
Thank you.
Thank you for coming.
Thank you.
There's people here that are working towards solving your problem and others like you, right? I'm curious, and others might be also curious, whether your physicians have you on some blood thinning medicines or inflammatory medicines.
That's a great question. So the blood thinning, yes, when I am in the hospital. So I do get blood thinning because of the pain meds that I do get, but not on a daily basis. I do use inflammatory pain meds as needed. So I do have ketorolac at home. Once I start feeling the pain, it's usually one of the first pain meds that I go to. I do have Dilaudid as needed. So we know that those are short-acting pain meds. But usually if I cannot manage the pain at home, I make sure I call Nina, who's sitting in the audience, just to let her know, give her the advance call that I am coming to the hospital. But yeah, I hope I was able to answer the question.
Do you wear a medical alert bracelet like I do?
No, I don't. I do have an Apple Watch, which I don't wear anymore, but I don't use that.
Will that help you in another hospital?
I don't think so because, I see faces here that I recognize from the hospital. I've been going to St. Paul's for over 20 years. I don't think, based on what happened the last time, and it's happened before, I don't think I'll be comfortable going somewhere else, which is a little bit limited because I'll give you an example. I do have family members that I do want to see back in Nigeria, but I don't think I can make that trip. When I have to go visit family in England or work has to take me out to Phoenix, those are trips I have to discuss with Nina just so that we could put a plan together just in case something happens. So it's pretty limited. And yeah.
Thank you again for joining
Absolutely.
us.
Thank you.
So we have a question online from Ben Lai. He asks, thank you for telling your story. What you said about the kids that need a community really resonates, and your experience is very important to hear. Do you find the stigma is less compared to when you're young? Additionally, do you feel that social media, where fact-checking is not always done, is helping or further stigmatizing the community?
I think it's worse now, and I think it is worse because of probably the drug crisis that we have. So I've heard from a lot of kids who tell me that they don't want to go to the hospital, and I understand why, because when they tell maybe the attending doctor who shows up or the nurse that, listen, the pain med that you've just given me isn't enough, just imagine how that sounds. Like, I need more pain meds. It does sound, I don't know how it is in other provinces or in the United States, But I do know that it's been worse here. I'm grateful that I do have a care plan that as soon as I get to St. Paul's, I can tell whoever sees me, please look into the computer. I do have a plan. In regards to social media, I'm in communications. I think for me, it's easier for me to be able to understand what's true or not. But for individuals who are not educated in what's true or not, especially online, I think there's a lot of false narratives out there. I once saw on social media that people were saying that some specific regimen would help sickle cell crisis. These were, and it's a little bit scary because when I was growing up in Nigeria, it was the same thing, right? People would come to my mom and say, "Hey, have you tried this?" Right? To some point where they even told my mom that, "Hey, maybe he should drink his own pee." You know what I mean? Those are the kind of things that happened in the 80s. It happens now still on social media, so it's a little bit scary.
So a couple of quick questions, I'll be brief. One is, Dana Devine is on page 8 of your thing, and one of the things she did when she was at Duke way back was the use of D-dimer to try and get rid of the problem of physicians believing the person who claimed they're having a sickle crisis were looking for opioid addiction. I'm not sure what the status of this is now and whether it's used locally. But the other question I had is a bit more general. Is there any genetic screening in West Africa prior to marriage? Because presumably both your parents were carriers.
That's a great question. I had to do it here when I met Naomi, and we decided to have Brixton. In Nigeria, no, not that much. Unfortunately, what we see in Nigeria is, when you start a relationship with someone, you know what I mean, and for you to start thinking about, okay, you know what, let's get screened just in case of our kids. It's hard for you to think about that, you know what I mean? I've always said that, I would never wish the sickness on my worst enemy, and so Naomi and I decided to do it at the Women's Hospital. But in Nigeria now, still no screening. But what we saw, like I said, in the 90s was there was a lot of communications about sickle cell disease, so there was a little bit drop. There was a drop, but now not.
Just had a comment to answer some of the questions that have been asked so far. So I think the trouble with going to different hospitals is, as a program, we've tried various things. We've tried giving our patients wallet cards to go to bring to hospital, and we find that people, unfortunately, sometimes will ignore them or not call us when it says explicitly, call our program. Here's what you should do right now, but also call us. We find that, unfortunately, emergency providers just are not reaching out as often as we would like, and not necessarily sort of people are saying, "Oh no, I don't need to see that," when our patients present their cards to kind of peripheral ERs. So I think the folks at Vancouver General and St. Paul's who see some of our patients a bit more regularly and also are on the same electronic medical record have a bit more experience, and they're a bit more able to manage these things. But yeah, I'm not sure that medical replacements would help too much when they're ignoring all of our wallet cards, but it's a good question. And with the screening, I think it depends on the part of the world. I know places in the Middle East will have routine premarital screening, in part for thalassemia, but also for sickle cell. But yeah, it's partly a resource issue, I think. And lastly, the D-dimer question. At this point, we don't have any validated, widely available biomarkers to diagnose a vaso-occlusive crisis, which is unfortunately part of the problem. It's very challenging sometimes for folks to diagnose these things, and they don't necessarily trust our patients. And there is no specific gold standard lab test or biomarker that we can use. So we would love to see that, but not yet.